Hi guys, Dr. Rob Barrington here with some more nutrition advice. I'd like to talk today very briefly about glucosamine and the supplement glucosamine sulfate. Glucosamine is an amino sugar. It's found in the diet naturally, but you can increase your intakes of glucosamine by taking a supplement. And in particular, glucosamine is found in high concentrations in the exoskeleton of crustaceans, and supplement companies take these crustaceans, they remove their exoskeletons, they crush them up, they put them in tablets, and you can take that as a supplement to increase your intake of glucosamine. Now, glucosamine has a number of roles in the body. It's a precursor to glycated proteins and lipids, and these have a wide range of functions in the body. Glucosamine has been shown in clinical trials to benefit joint pain, and this is the reason most people take glucosamine. It is effective, it is an anti-inflammatory, and those people with joint pain who take glucosamine do show benefits, and those benefits are usually as good as, or if not better than, those people taking non-steroidal anti-inflammatories. So it has been shown to be effective in clinical trials, and it is an effective joint supplement. However, there is a study that's been done that looked at a number of dietary supplements to see if there was an association with these supplements and health. And the only supplement they found that showed a positive association with health was glucosamine, and those people who took glucosamine sulfate had a lower risk of total mortality. In other words, they lived longer and they had less risk of death. Now, the reason that glucosamine is likely effective at reducing mortality is because many of the diseases of the West, such as obesity, such as cardiovascular disease, such as the metabolic syndrome, such as type 2 diabetes, are diseases of inflammation. And if you can reduce that inflammation, you can reduce your risk of mortality. Is there a better way to reduce that inflammation other than taking glucosamine? Yes, there is. The best way to reduce this systemic inflammation is to abandon the Western diet. The Western diet is the cause of this systemic inflammation, and the antidote to this inflammation is to consume a traditional diet, something like the Mediterranean diet that relies heavily on plant foods. It has none of the metabolic poisons found in the Western diet. It contains high levels of unrefined whole grain foods. It contains high levels of unprocessed foods. It is the antithesis to the Western diet, and whereas the Western diet is a diet that causes disease and inflammation, traditional diets have been shown in those people, if they are diseased and they do have inflammation, it has been shown that it can reverse that condition and it can reduce the inflammation, and that is why traditional diets also are associated with a reduced risk of total mortality. So if you're taking glucosamine for your joints, you will probably be benefiting in other ways if you are consuming a Western diet, but I would highly suggest that if you are consuming a Western diet, you consider abandoning it and you consider consuming a traditional diet with traditional eating practices.